So I'm Ulrich Brinkmann. I'm working in Roche Pharma Research and Early Development in Penzberg, that's located close to Munich in Germany. I'm working on recombinant antibodies, antibody delivery systems and payload delivery systems. In Penzberg ourselves, we are mainly working in large molecule research and in oncology. In the antibody space, the most exciting project we are working on and have worked on is differentiated antibodies, for example, antibodies which have a very specific mode of action. An example is Gazyva, an antibody against CD20, which is much better than anything on the market, recently approved, and we are really proud to have worked with this particular antibody. My thoughts and the thought of many of our colleagues is that this currently is something in early exploration, mainly in the academic field. And if you ask yourself why one should do it and how one should do it, and maybe until when these molecules are available, to get to the first question, why, it could be something that it's even more differentiated, like bispecific antibodies. You can kill whole pathways by knocking out one molecule or one target molecule after the other one. On the other hand, you have to be cautious about what are you doing to the patient. So the safety profile of these molecules may also be an issue. The second question, how these molecules can be generated, I personally believe this is just a question of technology, and labs, institutes, academic institutions, as well as large companies like we ourselves, which are good at engineering proteins, will be able to manage to produce these molecules in a reproducible manner. Also clear that these molecules have to be characterized in really a very sophisticated manner. So it's not as easy as just generating cell lines for producing simple antibodies, but it's much more sophisticated. You have to invest more work, and especially in the analytics, downstream processing, purifying of those antibodies, you have to have much more knowledge that compared to normal antibodies.